Engage Consult for healthcare teams. Collaborate across your network. Collaboration with Engage is easy. You can see here in my practice, we have all of these team inboxes set up where multiple clinicians or team members can cover a particular inbox. But you can also see here, there's other organisations that have shared inboxes with me at my organisation. So we've got some here, here and here. They can decide to share one team inbox with you to keep it simple, or they can share multiple, as you can see. Easily manage patient requests. Managing Engage requests is simple. You can see here, I'm on the request tab, and you can see any inboxes that I've decided to cover by selecting the groups here, and I just tap them to cover them. You can see all of the requests together or individually. We can see here that this patient's verified, and we do have clinical system and PDS patient matching. You can put a priority on the request, add a status, message the patient, or start a video consultation. And you can view all aspects of the request along the bottom. So here, you can see who submitted the request. You can add notes, including from a template, files and attachments, and assign a note to someone. You can send the patient a message, and you can notify them of their message in a number of ways: email, SMS, push notification with the Engage app, or the NHS app. You can add files or attachments from your computer or from the patient's record directly. You can add a fully coded questionnaire that we've built, or you can build your own and attach it here and send it to the patient to complete. You can add an appointment booking link depending on the clinical system you're using. You can see any files or attachments here. You don't have to click on them, but if you do, it will blow it up nice and big for you. Readings, you can see in here, and you can see the full audit log. You can also assign requests to a colleague within your practice, to a team inbox or group within your practice. And if you have sharing agreements in place, you can also assign requests to another team inbox or another colleague at another practice or organisation within your network. You can also access some of the Engage features with our floating desktop toolbar, which you'll find in the top right. If you hover over the symbols here, it will say Open Toolbar, and then you can click. And the toolbar will appear where you can convert back to the client, start a video call, create a patient message or a batch message, create a request for a patient that's calling into the practice, or you can call the patient through to their appointment if they've arrived. Clinical system integration. Adding requests to the patient journal in your clinical system can be done here. You just go Action, Send to Clinical, and then you can edit any headings that we've entered for you. Add some extra detail, choose the method, the outcome, but you don't have to if you're in a hurry. You can add additional clinical codes for anything that might have been picked up in the request. We'll automatically code it as an e-consultation in the consultation record. And although we'll select them for you, you can decide not to include something in the clinical system if you feel it adds no value. Even if you've added a note that is meant for internal colleagues only, you can just simply untick it at the side here. Equally, if the questions that you've asked and the answers that patients have given aren't very helpful, you can untick them and add the rest to the clinical. You just hit this button here. As you can see in the settings, we work with all the major clinical systems, and you can decide if you'd like Engage Consult requests to appear in the record as structured data or a PDF. If you're migrating from one clinical system to another, Engage will work as normal and will take care of the write back when your new system is up and running again. Here's some examples of what the structured, easy read data looks like in the clinical systems we work with, or some of them. As you can see, it's nicely formatted so you can read it in a hurry. Customise your Engage Consult settings to work for you. Within Engage Consult, we'll give you access to Management Console, where you'll be able to access all of the settings and make the service work for you and not the other way round. Here you can see Care Navigation, where you'll be able to intelligently route patient health requests to the correct clinician, team or organisation within your network. Here's some examples. You can see we've got asthma requests being directed to the asthma clinic. We've got blood pressure being marked as urgent and being directed to our AMP. And you can also set up rules for individual or groups of patients. Here we can see I've got a rule for Jenny Johnson to be marked as urgent and to be routed to her duty doctor. And we'll add the rule here. You can see the other options you have. So you can add rules based upon medical problem, admin query, health data, questionnaire, or the patients themselves. You can also see here that you can control your demand. You can, at any time of day, come in and change the hours of service availability. You can add request limits against that, and you can vary it for your admin or your medical teams. You can also switch the service off instantly if you need to. And you can provide patients with their own personalised link, which can bypass any request limits you've put on. And this might be useful for patients in care homes, frail elderly, or patients at the end of their life. You can also adjust any settings, so things like patient-facing text, you've got full control. You can set up age ranges. More importantly, you can amend the questions that we ask patients when they're submitting a request. We set this up for you for a new problem, existing condition, or a get back in touch, but you can completely edit these questions and you can remove them altogether, replace with a different question. You can remove them, add new ones, and you can also decide which are going to be required or mandatory. You can also build your own questionnaires in here. You can see I've already created one to say we need more information about your sore throat. And you can also put questionnaires on the patient portal where patients submit requests. You can also adjust your total triage settings so that you're not asking any on-screen questions to make it easier on care navigators. You could also tick the box to enable translation in Engage, because we do translate requests in any language at all. The patient will not be prompted to do this. They can just simply type in their own language and Engage will pick it up using the Google Translate API. You can also control all of your staff. You can add team inboxes. And you can also access the check-in service and the messaging service from the client as well.